So now we're going to talk a little bit about what highly pathogenic avian influenza could potentially look like. I just wanted to give a little warning that some of the clinical signs that I'm going to be talking about and some of the images might not be super pleasing to some. So what does it look like? Well, it unfortunately can look like a lot of things. I guess the most common and biggest indicator of disease is probably going to be sudden death loss. And I would add to that sudden death loss of more than one bird, because we know, birds can die, things can happen like that. But seeing a mortality pattern should be an alarm that should go off in your head that something isn't right. On commercial farms where feed and water consumption is monitored, they use different technologies to monitor things like that. One of the things that they've seen early is a decrease in water consumption. And I mean, I guess that makes sense because when we're sick, we don't want to eat or drink. And it's kind of the same thing with birds. They don't want to eat or drink when they're sick. So I guess I would also argue that feed and water consumption is something as you as a small flock owner could probably be something that you're monitoring as well. I mean, obviously you're not going to have the technology to do it, but it would be more of like an eyeball method. So, you're filling your water to a certain amount and keeping track of kind of how much they're drinking. And, if you notice that they're not drinking as much as they normally are, maybe that would be an alarm that would go off in your head that something isn't quite right. You may see a decrease in egg production. And with that, you might see some soft or misshapen eggs. Obviously, again, kind of like with the mortality, if you're seeing just one soft or misshapen egg, it's not too much of an alarm. But if you're seeing a number of them, then that can be something that to be worried about. Obviously, respiratory issues, so like coughing, sneezing, nasal discharge, gasping for air, those sorts of things. Another big thing that has been seen with the cases that are going on currently has been a watery yellow kind of green diarrhea. And you might not be noticing that like directly on the ground, but it might be more noticeable staining around the feathers of the vent area. And then just some more signs to have on your radar. Birds might look depressed. They might be quiet, which again makes sense, like us when we're sick. In addition to that depression and less vocalization, they might also have kind of a hunched appearance, and their feathers might be kind of ruffled up. And I'll show you a picture in the next slide, just kind of what that might look like. And that's just another indicator that they don't feel good. So you might see on the head, neck, eyes, and or legs. Purple discoloration in addition to that swell might be seen on like and the wattles and the legs. And then additionally, neurologic signs can be seen. So things like tremors or shaking, twisted necks, paralyzed wings. Birds might be like laying down on their sides or laying on their sides and like paddling or pedaling almost. So these are just some pictures of some of the things that I talked about that you might see. So the first picture, you can kind of see some of that green, yellow, watery diarrhea. The next one, you see this bird laying down. She probably can't get up or refuses to get up. You can see some of the ruffled feathers. And then if you look very closely, you can see that blue, purple discoloration on the comb and wattle. The next picture over would be like you're looking at the bird upside down, so like their chin. And that's just some of that swelling that can be in addition to that discoloration. The fourth picture there, that bird is kind of hunched over, its feathers are ruffled up. And then you can kind of see on this fifth picture here, it's very subtle, and it takes kind of a good eye to see it, but that purple blue discoloration on the leg. So this is just showing kind of the progression of the disease and how quickly things can happen and change. So this first picture, like 0 hours, Probably hearing some respiratory noises, some of that coughing, maybe some sneezing, seeing maybe some nasal discharge. There's maybe like 1 or 2 birds in this picture that are laying down, but overall they don't look too bad. And then this next picture is about 2 hours later. And as you can see, a lot of the birds are laying down. They're kind of hunched up, some ruffled feathers. There's probably a lot of respiratory noise going on in the house. Other than respiratory noise, the birds are probably pretty quiet though. They're probably not going up to the feed and waters. And then this next picture is less than 24 hours later. And as you can unfortunately see, there's only 1 bird left in this section, in this picture in the barn. So just kind of showing that things can happen and progress pretty quickly.